This is part three of our three-part mini-series on measles, mumps, and rubella. We've covered measles, we've covered mumps, and today we finish with rubella. Rubella is sometimes called German measles, but despite the name, it isn't actually measles. It's caused by a completely different virus. And rubella is interesting because for most children and adults, the illness is usually pretty mild. Symptoms often begin with a low-grade fever, headache, runny nose, red or irritated eyes, and swollen lymph nodes, especially behind the ears and along the back of the neck. Then comes the rash. It usually starts on the face and spreads downward to the chest, arms, and legs. The rash often lasts only a few days. Adults, particularly women, may also develop joint pain or stiffness that can sometimes linger after the other symptoms are gone. But here's something important. Some people infected with rubella have very few symptoms or no symptoms at all. And that brings us to the reason rubella is still taken so seriously. Pregnancy. If someone becomes infected with rubella during pregnancy, particularly during the first trimester, the virus can cross the placenta and infect the developing baby. The consequences can be devastating. Rubella during pregnancy can cause miscarriage or stillbirth. It can also cause congenital rubella syndrome, or CRS. Babies born with CRS can have hearing loss, cataracts, heart defects, developmental problems, and other serious complications. So the biggest danger from rubella may not be what happens to the person who actually has the infection. It may be what happens to someone they unknowingly expose. Rubella spreads mainly through respiratory droplets when an infected person coughs or sneezes. And because someone can spread the virus before they even realize they're sick, controlling an outbreak can be difficult. Fortunately, we have something that dramatically changed the story of rubella in the United States: vaccination. The MMR vaccine protects against all three diseases we've talked about in this mini-series: measles, mumps, and rubella. And while rubella was declared eliminated from the United States in 2004, eliminated does not mean the virus has disappeared from the world. Cases can still be brought into the country through international travel, which is why maintaining vaccination remains important. If you're unsure about your vaccination history, your child's vaccination history, or whether pregnancy changes what you should do, talk with your healthcare provider, because sometimes the disease that looks mild on the surface is the one we have the most important reason to prevent. And that concludes our three-part series on measles, mumps, and rubella. If you found this episode helpful, hit like, subscribe to the channel, and share it with someone who might find it useful. It really does help us reach more people. And if you work in healthcare or you've ever wondered what really happens inside a hospital after the rest of the world goes to sleep, check out my book, Nights Like These, available now on Amazon. It's based on more than 3 decades at the bedside and the lessons you don't always find in a textbook. I'm Arne Facklem, nurse practitioner and fellow of hospital medicine. This is Beyond the Stethoscope.